Hi. Have you wondered what are the difference between plastic surgeon, a dermatologist, and the aesthetic physician? I'm sure you have gone through the internet and you have read about books. You have your experience with all the doctors, and you have talked among with your friends. And sometimes you wonder what are the difference between these three specialties. Now, let us go through what entails the scopes that is done by the different type of doctors here. Now, first of all these three specialties are medical doctors by qualifications, and that means they have to go through the medical degrees and get a proper training, a basic licensing, and before they can embark in the further training. Now, for plastic surgeons are specialist surgeons where they are trained to perform surgeries. So, like for us, we do surgeries that range from reconstructive procedures to cosmetic procedures. And reconstructive procedures can be surgeries for burn patients, facial trauma, patients for tumor removal and reconstruction, hand injuries. And for cosmetic procedures are things like liposuction, breast implants, and abdominoplasty, autoplasty, rhinoplasties. So at the same time, plastic surgeons also can do office-based procedures like Botox, fillers, and microneedling, chemical pills, and all. Now, the second specialty is dermatologists. Dermatologists are doctors that specialize in skin condition. So they are actually medical specialists. They have gone through the basic training, they get the qualifications, and they've got the further training in the skin conditions of the body. So that means they are a subspecialist that specializes in skin problems. Now, there are certain dermatologists that also do aesthetic procedures after obtaining certain qualifications. And for these specialists, apart from seeing medical conditions affecting the skin, like eczema, infections, autoimmune diseases, they also do office-based aesthetic procedures like Botox injection, BT injection, fillers, microneedling, chemical pills, and etc. Now, the third categories of doctors is what we call as the aesthetic physicians. Again, aesthetic physicians are doctors that have obtained all the necessary basic qualifications to become a doctor, and then they specializes in aesthetic medicines. They have to obtain certain qualifications and requirements before they can be recognized as an aesthetic physician. Now, in Malaysia, actually, we have what we call as the LCP. That is a letter of credentialing and privileging by the Ministry of Health that actually will allow you to do all the aesthetic procedures. And the LCP is divided into three chapters. You have chapter 1 for aesthetic physicians, chapter 2 for dermatologists and medical specialists, and chapter 3 for surgeons and plastic surgeons that wants to do aesthetic procedures. Alright, thank you, and please subscribe to my channel to know more about related knowledge. Thank you.